Let's talk about one of the hardest things to do in dentistry, which is matching an implant crown on one front tooth to a natural tooth next door. This is a recent case that I did on a patient who had pretty high expectations, as would anybody when they're replacing a front tooth. And not only did he have high expectations, but he also had natural teeth on all of his front teeth, which makes the case harder because to match porcelain, which is a different material than enamel, to enamel with multiple shades, fracture lines, a jagged edge on his front tooth was not an easy task. But we were able to accomplish it, I think, in a pretty amazing way with the use of dental photography. Dental photography is so important in being able to take the right kinds of pictures with the right kinds of lighting, the right filters, using filters on top of the camera in order to be able to communicate with the lab exactly what colors to put where is critical in being able to pull off something like this. And if you see the case that I've attached below, you can see, I think we did a pretty decent job. So this was all with the use of just one implant crown. And what's great about this was that a lot of dentists would probably encourage the patient, we're never going to be able to get it to match exactly. And honestly, I've even said that to patients in the past. But we're never going to be able to get it to match exactly. You might be better off doing veneers on the other front tooth or on the front four teeth so that everything looks more harmonious. And in a lot of cases, that's probably true. But sometimes the patient just doesn't want to. And you can set their expectations, but when you can pull it off, it's a really gratifying experience because the patient walks out with their confidence restored instantaneously. And that is one of the things I love most about my job.